if we're going to stay in normal and we're not going to use any drugs at all, we'll stay with the basics. So walking, squatting. Can you squat? So the idea behind squatting is that you open up your pelvis, okay? You open up, you're kind of like Charlie Chaplin for all the world. You're putting your feet at a kind of a funny angle, all right? Then you get your elbows ready just to put it at your knees, and you're going to put your hands together, and then when you're ready, you're going to squat down, okay? Now, if you can manage to stay like that for about 2 or 3 minutes, you're doing great work, okay? But if you could get 30 seconds, 40 seconds, anything at all to start with, and then start, just gradually introduce it. There's a few other ways that you can do it, because women are pregnant, so there's a bit of gravity there, so it's kind of hard to get into that position. So I'm just going to show you up against the door another way that you could actually squat. So if you use the door, okay, make sure it's a door that's closed now, no one's going to open it, all right? And you can slide down, okay? Then you're protecting your back, you're opening up your pelvis, yeah? And you're getting brilliant work at promoting gravity. So you're allowing that baby's head down. And in labour, if you do it, you have the contractions pushing the baby down through the pelvis, and you're opening up the pelvis to allow the baby down. So it shortens your labour, okay? Does that make sense? When you're getting up, slide up, okay? Mind your back, is that okay? You only get one back, so you have to protect it. Another way of doing it, if you have an exercise ball, and again, just pop it in there on the door, okay? Lean into that ball as much as you can, okay? And then just slide down. Now, this is much easier on your back. My back is totally supported there, and I can roll up and roll down. But when you're in a squatting position, just stay like that. Have a glass of water, cup of tea, whatever you need, okay? So they're great ways of doing it. Or an alternative way of doing it is I'm going to get you to sit on this chair over here, Mary. Okay, so if you have your birthing partner in with you, so your mammy or your husband or partner or whoever it is, you get them to sit on the chair, okay? And now I can squat down like this, okay? And that works really well. And if you want to sway, do, but you don't need to, just that squatting. It's fantastic. It opens up your pelvis by about 28%. It's huge, okay? When you're lying on the bed, so this is your pelvis, all right? And it's a very sturdy structure, all right? And that's what keeps us upright. In pregnancy, all the ligaments are loose, so it becomes a bit unstable. So if you ever see a lady walking down the street in front of you and you can kind of see a waddle, do you know what I mean? Mm-hmm. Okay, the reason for that is because, so you know they're pregnant ever before you see their tummy, all right? And the reason for that is because the hormones makes the pelvis a little bit unstable, okay? So when you're squatting, what you're doing is you're opening up this pelvis as much as you can. That's not a particularly good one now, and it allows this pelvis, so you allow as much room as possible for the baby's head to come down, okay? Is that all right?
Yeah, perfect.
And this sacrum here, if you're lying on the bed, it kind of rotates in the way, you know, it pushes in the way like that. Whereas if you're standing or taking your weight on your hips and your upper thighs, this has a chance of actually pushing back the way. So it opens up the diameter and it lets more room for the baby to actually come down. Is that okay?
Yeah.
There's another alternative to squatting if you want. So if you're sitting at home watching the telly, rather than lying on the couch or, you know, just slouched down, promote gravity as much as you possibly can. Now you do it when the baby's head is down. So you don't want a bottom going into the pelvis, all right? So when your baby is coming down into the pelvis, you want it to be a head. So this is your pelvis, all right? And like we explained earlier, and the baby comes into it in different positions, but we're talking about positions to allow the baby to come down easier, okay? So when you're lying on the bed, all right, it doesn't do an awful lot for the contractions and it doesn't use your pelvis the way that it should, okay? Whereas when you're standing up, all right, it allows the weight of your body, I suppose, and the weight of the baby to come down through the pelvis easier. So the more you walk, the more you do yoga, the more you do cycling, if you cycle but don't pick it up in pregnancy, if you've done it beforehand, the more you open up your pelvis doing your squatting, the better chance you have of your baby coming down into the pelvis the way that it actually should. Is that okay?
Yeah,
all right.
perfect.
So we talked about the ball, we talked about the chair. This is just another alternative for you that you could be doing at home when you're getting the pains early to allow the baby to come down through the pelvis as much as possible. Okay, so a bit like John Wayne, all right? So you're going to straddle the chair, okay? So any dining room chair that you have, and the taller the better. So the idea behind it is that you put a pillow here to kind of keep you straight, all right? But if you look at my pelvis is all the way open. So it's doing exactly the same as what it was up in the ball, and I'm promoting that gravity or the movement of the baby going down into the pelvis, and I'm sitting here watching Coronation Street. So it's very comfortable, and I'm being distracted by the telly or the music in the background, or I could be having a cup of tea. So you're losing time, and that's the idea behind labour. So it's to stay at home for as long as you can in the first part of labour. So labour comes in 3 stages. It's the first stage, the second stage and the third stage, okay? And the first stage of labour is 3 centimetres considered established labour, so 3 centimetres to 10 centimetres. Then the second part of labour is the delivery of the baby, okay? So how the baby actually comes down into this world. And then the third part is the delivery of the placenta. Okay.
That's interesting.
Yeah, so the placenta usually comes fairly easily, so we'll go in reversal maybe. It usually comes fairly easy. We let all the blood, once the baby's delivered, we let the blood over to the baby, okay? And there's a pulse on the cord, and we can actually feel it. So once that cord stops pulsating, or we think that the baby is crying enough, so say 2 to 3 minutes after the baby's delivered, then we can actually clamp the cord, and you or your partner can actually cut the cord. And once that cord is cut, then that baby is yours forever and is in this world breathing on his own, all right? But the placenta still has to be delivered, okay? So we offer, but it's up to yourself whether you actually take it or not. It's an injection, and we give it in your thigh, all right? And it's syntocinon, so it's kind of the same, it is the same drug as we give in the drip, it's just a different volume that we give. So the idea behind it is that it causes the uterus to contract, okay? And it allows the separation of the placenta. So once we see the signs of separation, we'll have a sterile field down here, and we'll use a clamp just to hold the placenta, and literally we just tug the placenta and it should come away from your uterus, okay? What you do with that placenta, we look at it just to make sure. So this is the maternal side, okay? So that's the bit that's been attached to you in the uterus. This is the fetal side. So in there, it's like a big balloon. So if you can imagine a balloon of water, and the baby's cord and the baby itself has been curled up in your uterus for the last 9 months. So this is attached to your uterus. That's the cord, and this is your baby, okay? We want babies to deliver at over 37 weeks pregnant, all right? So over 37 weeks and head down. So any baby that's not head down, they'll offer either to turn the baby, or you'll be in elective section because of being breech, okay? And what I mean by being breech is that the baby is coming like this. Okay, so the bottom is going into the pelvis rather than the head. Okay, so if that's the case and you're on your first baby, what they can actually do around say 36, 37 weeks is that they can actually come up to the labour ward, and then we'll do a tracing like we did on the baby, all right? And then they'll actually give you a tributaline. It's a muscle relaxant, so it makes your muscles not tight, that it makes them nice and soft, okay? They'll scan you with an ultrasound, you know, like you would downstairs in the perinatal unit, but we do it here. Then they find where the placenta is, and they actually turn the baby, okay? And they turn the baby whatever way it's easiest to turn, and it'll be done by an obstetrician. Midwives don't do it. It seems to be, you know, it's always done by a doctor. Is that okay? So they turn them into that position, and for the vast majority of them, they'll stay down that way. And for the others, they won't like it very much.
And how would they turn them, Marcella? With their
hands.
With their hands?
Yes.